The film In Case of Emergency was a well made documentary about the truth and reality behind the people we see in the emergency department and all they have to deal with on a daily basis. From the daily stuff that would lead the majority of the population to have some trauma that they have to process and move on from within minutes. Within the emergency department, my key takeaway was to be more grateful as it helps them to keep doing what we ask of them so often. So, an overview of the film. So, as explained, the emergency department is relatively new compared to most other departments. The reason most refer to the ED, the emergency department, as the ER is because that's exactly what it used to be. Just one singular room that was run by a group of nurses. Of course, now it has grown into a tremendous amount, mostly due to it bringing a lot of people's primary care. A lot of people wait until it gets so bad that they have to go to the emergency department. That, of course, plays into how expensive healthcare is in America. The emergency department, compared to other majority of healthcare, does not require a proof of insurance for treatment, and it doesn't require anything at all. It's there to save your life. It's there when you're having something, an emergency, and they'll treat you no matter what. So this is what makes it different from the majority of other healthcare. Another difference is how fast-paced and the number of patients that can be processed. It's not like anyone's being rejected from the emergency department. They're just putting on a queue based on how critical their care is. If they're a trauma patient that's needed right then and there, then they're going to be processed immediately compared to somebody that might have broke their finger, but it's not exactly broken, so they hold off on people like that. So, how do the health professionals still make you feel safe and seen and build that connection when there's so many people going in, out, and out? And I think that's why it takes a certain type of person to work in the emergency department, because the meaningful connection is what gets the patients and staff through whatever trauma they may be going through. So within the film, I think somebody that really showcased this well was Kathleen Robinson. She's the main person you follow. She's an RN at St. Joe's Hospital, emergency department in North Carolina. It's the third largest in the nation. And basically she walked us through the film. She walked us through her everyday life when it came to the emergency department, and the three issues that came out to me throughout the whole film was she highlighted lack of insurance, how that plays a big effect, the opioid epidemic. She highlighted that's an epidemic because she sees so many people die from it every day. And then one that we didn't really cover in class, but the film covered, was COVID-19 and the effect on healthcare professionals on their mental health and what they had to deal with through all of that. So, also one other thing that I think was cool that was pointed out in the film was how the evolution of the emergency department, how it started with Florence Nightingale and what she was doing, then like Army medics within World War II, World War I, and then finally the emergency department started. But before that, there was no emergency department. So, the three major issues that I mentioned were health insurance, the opioid epidemic, and the COVID-19 pandemic. So when it comes to the healthcare, the population of the United States lacks the coverage that we all need and hope to have so we can stay alive and well. The emergency department is one of the only places you can go without any proof of insurance and still be treated. It truly isn't even the fault of many that have health insurance, as prices to continue to increase. One patient in the documentary even said it's almost cheaper to pay the bill than to pay for insurance, which is the truth for many. It was stated time and time again by the nurses and professionals in the documentary how the communities need to make a change in healthcare coverage accessibility. It's not something the hospitals can do, especially the emergency department. It's not their job to do. Instead, it's us as a community that needs to come together and help each other with that. Another thing that the community needs to do to make a change is deal with this opioid epidemic and the addiction that comes with it. So rehab isn't as cheap or accessible that it needs to be for many. So as seen on the figure on the left, the national overdose death is increasing exponentially. You can see it started in 1999 at that small little bar, and now in 2021, it's already at 80,000 people a year that die from the overdose. So it was even said in the film that only 8% of opioids are used. 8% of opioids used are prescribed by a physician. This number is only going to increase if nothing is changed within the community. There needs to be better access to rehabilitation, more groups working towards getting more people sober, and just more effort all around. And then finally, the last major issue that I wanted to talk about that wasn't really covered in what we went over, but more I thought was interesting, was the COVID-19 pandemic and its effect on the mental state of the healthcare professionals. So we all know through COVID-19, we were able to be with people that may have gotten it and were in the hospital. Only people allowed in the hospital were the people being treated and the people that were treating the patients. So in the film, it was talked by an older nurse. He had been there for 35 years, I think, and he said that he had seen 4 to 5 deaths on a shift. And so I figure a 12-hour shift, 4 to 5 deaths, somebody's dying every hour. And the people, there's nobody else to comfort those patients as they're dying. It's just you. So he said that people would lean into him and basically cling on to him as they're dying, because that's the only person they have to lean into. Only last embrace they will have is from a stranger that works in the emergency department. And after all this, after they deal with all those 4 or 5 patients passing away, they would have to go back to their house, back to their home, back to whoever they maybe their family, maybe their kids, and they'd have to act normal, because they can't bring that home with them. And after the pandemic ended, a lot of healthcare workers got out of the profession because of how much it put them through, going through COVID-19 and everything like that. So I think it just needs to be talked about more, about the impact it had on the healthcare professionals' mental health. And then it just needed more appreciation towards what they went through and what they did for us. So, healthcare policy, law, and ethics. I associated the emergency department, or I associated the healthcare policy with how the emergency department is having to treat all patients no matter the lack of insurance. So that's more like a healthcare policy, like they have to treat them no matter what. The opioid epidemic, I fold that more into the ethics side of things, because that's how the community needs to work together to help end the issue and to make a change. So ethically, I think we should look more towards it and not away from it. And then finally, the COVID-19 pandemic, I think that falls into policy again, because the policy was nobody can go in, nobody can go out, only the patients, people being treated. If that policy wasn't there, then these healthcare professionals wouldn't have had to comfort these people as they were dying. They wouldn't have had to see so many deaths. It would have been more, they did all they do, and then patients' families can come in and be with them in their final moments. But instead, due to the policy, the professionals were the people that had to be there for them in their final moments. So what can we take away? I think the biggest takeaway from this documentary is how self-centered and worried only about ourselves we are. I think we as a people need to make a change in the way we take care of our neighbors and how we look at them. Instead of seeing a person on the street who may be on drugs, do not look down on them. About how one point, I think, that's why I always think it was at one point that was someone's little baby. And now through things that we created as humans, these drugs that they may be on, they have fallen and can't help themselves out of that hole. A lot of people won't be able to help themselves out of that hole no matter how hard they try. So that was the one big thing I think I took away from it. I think we all could take away from it. And then same thing being for healthcare professionals, and how we need to show more appreciation to what they went through during COVID. They don't get enough thanks for that. Then my final personal opinion is we as a people need to stop being so self-interested and self-interested only. We need to be more grateful, more kind. We need to stop looking down on others because they may not be in a better, because we may be in a better spot than them. I think we need to do better to lift each other up and be more active in our communities, because if we can make our community good, then we did our part at the end of the day. We don't have to make the world good. We just have to make our community good, and then we're making the world better in a real way. So I think there's programs in Wichita that I've looked into that need volunteers for CNAs and just volunteers in general that can provide healthcare to people on the street. And then one other thing was the nurse Carolyn said in the documentary that she loves the meaningful relationships we make. And I think that's one thing that we should all look into, is the meaningful relationships we can make in our day-to-day life. And asking somebody how they are, just a simple compliment. Like, some people may need that more than you could ever know. And that's it. Thank you for listening to my little lecture. And I'm Joel Reyes. And these are my references.